Welcome to another episode of Medically Speaking. I'm Bullion, your host. On today's episode, we are going to be discussing hormonal imbalance and how it affects both men and women. Firstly, you might want to know, what are hormones? Hormones are chemical messengers which controls everything from metabolism to mood to sleep and to reproduction, which when out of balance can cause health issues. Now, hormonal imbalance is when the body produces too many or too little of a particular hormone, which can be due to genetics, lifestyle choices, stress, or even underlying medical conditions. Here are some common causes of hormonal imbalance. Chronic stress. When you stress too much, it increases the release of stress hormone known as cortisol, which can lead to anxiety, weight gain, and fatigue. Also, poor dieting. For instance, high level of sugar intake can disrupt insulin levels. There are other causes such as lack of sleep, environmental factors, and even medical conditions. Conditions like PCOS, which is the polycystic ovarian syndrome, and diabetes all affect hormone levels. Hormonal imbalance in women. Women experience frequent hormonal fluctuations due to pregnancy, menstruation, and menopause. Here are some of the most common imbalances. Just like I mentioned earlier, PCOS, which is the polycystic ovarian syndrome, which is the excess production of androgens, male hormones such as testosterone, and some of the symptoms are irregular periods, excessive body and facial hair, acne, and weight gains. There are other imbalances such as hypothyroidism and hyperthyroidism. Hormonal imbalances in men. Men also experience hormonal fluctuations, especially with testosterone, because as men age, testosterone naturally decline. But there are some other factors that can affect hormonal imbalance in men at any age, such as high estrogen in men. Estrogen being a female hormone, when it is excessively produced, can have symptoms such as gynecomastia, which is the male breast enlargement, low libido, infertility, and mood swings. Other imbalances such as low testosterone, also known as hypogonadism, which can be caused by poor dieting, stress, aging, obesity, and the use of certain medications, with symptoms such as low libido, erectile dysfunctions, mood swings, fatigue, and increased body fat. How hormonal imbalance directly affects everyday life, such like weight gain and metabolism issues, mental health effects, sexual health and fertility, energy and sleep problems, skin and hair changes. How to naturally balance hormones. Eat a hormone-friendly diet that are high in fiber, healthy fats, lean protein, and antioxidants. And also avoid processed food and sugar. Exercise regularly. Manage stress. Learn to indulge in meditations, yoga, deep breathing, and therapy. This can actually help lower your cortisol levels. Hormonal imbalance is a common issue that affects both men and women in different ways. It impacts metabolism, mood, sexual health, and overall well-being. The good news is lifestyle changes, medical interventions, awareness, such like sharing this video to people who might be struggling with hormonal imbalance, can actually help restore balance. Follow us on all platforms at Medically Speaking for more of our health content.